Hello, I'm David Fillingham, the Chief Executive of AQuA, and I'm delighted to be presenting this next AQuA WebEx on the topic of whole system flow. For the last year, AQuA have been delighted to have a development project on this topic, funded in part by the Health Foundation, and working in really close partnership with other colleagues from within the AQuA. So I'm aiming to cover three questions. First of all, why is flow so important in healthcare? Secondly, what do we mean by whole system flow? And thirdly, if we manage to work out what it is, how do we improve it? And I'm really keen as part of the WebEx to get people's ideas and views and contributions on this. So first of all, why is flow so important in healthcare? It's probably actually easier to spot when we don't have good flow than when we do. So the young single mother with a toddler who can't get a GP appointment, the person who's held in an ambulance for a couple of hours, not able to get into the A&E department, the older person stuck in a hospital bed when what they want to do is get back home, but we can't get the right support in the community for them. Those are all examples of where the system is not in flow. People are waiting unnecessarily. And that's bad. That's a poor patient experience. It's a poor staff experience. Staff get very frustrated. And there's a really strong evidence base that it leads to poor outcomes, in some cases to avoidable harm and even avoidable death. And at a time when the NHS is so stuck for resources, this is a terribly bad use of resources. There's a phrase called failure demand, and failure demand is demand that's caused by us not doing something right for patients or not doing it at the right time in the appropriate way. Evidence suggests that maybe up to 40% of everything that's done across the NHS is failure demand. If we met the demand more effectively, we'd get happier patients, happier staff, and a better use of NHS resources. And flow is the opposite of all of that. Flow is when patients, staff, information and resources move smoothly through the system to the place where they're most needed, so patients get their care in a timely and effective way. So where's household system flow different? Well, a lot of the work that's been done to improve flow has just focused on the hospital bit of the care that patients need, and often just on emergency pathways, trying to tackle that knotty problem of the A&E department 4-hour wait. And one of the reasons I think that we're struggling to achieve some of those access targets is we're not thinking widely enough. We're not thinking upstream and downstream of hospitals. Whole system flow is where we engage the whole community, not just hospitals and community services and general practice and mental health, not just social care as well, but all of the other resources in the community, housing and education and voluntary groups and families and carers. How do we coordinate systematically all of those resources to get the right care for patients at the right time, delivered by the right person, so that there isn't that failure demand, so that the flow is smooth and effective without waiting, without waste and delay, and without harm to patients and frustration to staff. That's what we're trying to achieve. So if that's what whole system flow is, how on earth do we improve it? Well, our work suggests we need to work at 3 levels, all at the same time. We need to think about the end-to-end journeys that patients go on, starting at home with a problem, maybe getting the support at home so they never need to leave their own home. That would be the ideal. But if they do need hospital treatment and then again supporting the community after that hospital episode, how do we redesign that journey so that all the agencies, all the professionals work together on behalf of the individual patient, so that the care is carefully coordinated and that whole experience is a smooth and effective one. We need to use the tools of improvement to bring staff together from right across different agencies in the community in order to get that patient journey to flow smoothly. But secondly, we need to deeply engage frontline staff in that. We need frontline teams that are in themselves effective. If they aren't solid building blocks, then when we join them together, we'll just get a better connected mess. So as well as working at the level of the patient journey and redesigning it, we need to engage frontline teams and get each step in the process to be effective. And then finally, we need to work at the system level, because there are some big things that can get in the way of making that journey a smooth one. The financial incentives might be in the wrong place, the workforce isn't designed right, the information systems don't support it, or people aren't used to working together in a collaborative way, in a culture of teamwork. And that's the job of senior leaders, to make sure that we get the system organised so that we can redesign the end-to-end journeys so frontline teams can work together in a smooth and continuous flow. Now, none of that is easy. This is a massive challenge. That's why we've not achieved it so far. But I absolutely believe that this is the key to achieving that really big goal that we're all striving for, which is how we get better health for citizens, better care for patients, and do it with a better use of the very scarce resources that we have in the health and social care system. So I'm looking forward to exploring all of this with you through the WebEx. There are 3 big questions I'd ask you to think about in advance. The first is, what's your own local definition of your whole system? Who's in it? Who do you need to engage? Who do you need to build partnerships with? Secondly, do you have examples of actions that have been taken that have really improved flow in your system at the team level, at the service level, or maybe work that system leaders are doing together? And thirdly, what are the things that get in the way? What are the barriers that are going to prevent success in getting the system to flow smoothly? And how can we overcome those barriers? I think this is really important work, and I'm looking forward to us having a great conversation about these topics on the WebEx. Thank you.